Another day, another video of first aid by Type 1 diabetes versus Type 2 diabetes, understanding the key differences. Diabetes is a chronic disease that affects millions of people around the world. It is a condition that occurs when the body is unable to produce or use insulin properly, leading to high levels of sugar in the blood. There are two main types of diabetes, Type 1 and Type 2. While both types of diabetes share some similarities, there are also significant differences between them. In this video, we will discuss the key differences between Type 1 and Type 2 diabetes. Causes of diabetes. Type 1 diabetes, autoimmune disorder. Type 1 diabetes is an autoimmune disorder that occurs when the immune system attacks and destroys the insulin-producing cells in the pancreas. The exact cause of this autoimmune response is not fully understood, but it is believed to be a combination of genetic and environmental factors. People with Type 1 diabetes require insulin injections or an insulin pump to regulate their blood sugar levels. Type 2 diabetes, insulin resistance and lifestyle factors. Type 2 diabetes is the most common form of diabetes, accounting for over 90% of all cases. Unlike Type 1 diabetes, people with Type 2 diabetes are still able to produce insulin, but their bodies are unable to use it effectively. This is known as insulin resistance. Risk factors for Type 2 diabetes include being overweight or obese, having a sedentary lifestyle, and having a family history of diabetes. Symptoms of diabetes. Common symptoms of Type 1 diabetes. Type 1 diabetes typically develops quickly, often over a few weeks. Common symptoms include increased thirst and urination, constant hunger, weight loss, fatigue, blurred vision, slow healing wounds, nausea and vomiting. Common symptoms of Type 2 diabetes. Type 2 diabetes symptoms can develop slowly and may not be noticeable at first. In fact, some people with Type 2 diabetes may have no symptoms at all. However, common symptoms of Type 2 diabetes include 1. Frequent urination. 2. Increased thirst. 3. Feeling very hungry even after eating. 4. Fatigue. 5. Blurred vision. 6. Slow healing of cuts and bruises. 7. Numbness or tingling in the hands or feet. If you experience any of these symptoms, it is important to speak with your doctor. A simple blood test can determine if you have diabetes. Complications. Complications of Type 1 diabetes. Type 1 diabetes is a chronic condition that requires lifelong treatment and monitoring. People with Type 1 diabetes cannot produce insulin, a hormone that the body needs to convert sugar, starches and other food into energy. If left untreated, Type 1 diabetes can lead to a range of complications, including diabetic ketoacidosis, heart disease, kidney disease, nerve damage, eye damage, stroke and amputation. People with Type 1 diabetes must monitor their blood sugar levels and adjust their insulin doses throughout the day to keep them in a safe range. They must also maintain a healthy diet and lifestyle, and attend regular checkups with their healthcare team to monitor their condition and prevent complications. Complications of Type 2 diabetes. Type 2 diabetes is a serious condition that can lead to a variety of potentially deadly complications. These complications include an increased risk of heart attack and stroke, as well as damage to the kidneys, eyes, and nerves. Other complications of Type 2 diabetes include an increased risk of developing certain types of cancer and an increased risk of developing infections. Additionally, people with Type 2 diabetes are more prone to developing skin conditions, such as bacterial and fungal infections. Finally, people with Type 2 diabetes are at a higher risk of developing depression and other mental health issues. Managing Type 2 diabetes through a combination of lifestyle changes and medication, as well as regular checkups with a doctor, is the best way to minimize the risk of these serious complications. Treatment. Treatment for Type 1 diabetes. Type 1 diabetes is an autoimmune disorder that affects the body's ability to produce insulin. Treatment for Type 1 diabetes involves a combination of lifestyle changes and medications. This includes monitoring blood glucose levels, eating a balanced diet, exercising regularly and taking insulin injections or using an insulin pump to help regulate blood glucose levels. Other medications can also help to reduce insulin resistance and help to manage blood glucose levels. People with type 1 diabetes may require regular medical follow-ups and regular blood tests to monitor the condition. With proper management, people with type 1 diabetes can lead full and healthy lives. Treatment for type 2 diabetes. Type 2 diabetes is a chronic and often progressive condition that requires ongoing management and treatment. Treatment typically begins with lifestyle changes, such as dietary modifications, physical activity, and weight loss. In some cases, medications may be necessary in order to regulate blood sugar levels. These medications may include metformin and other oral medications, insulin injections, and injectable medications. Additionally, regular monitoring of blood sugar levels is essential to ensure that the treatment plan is effective. Education and support from healthcare professionals can help individuals with type 2 diabetes understand their condition, manage their symptoms, and make lifestyle changes.